So you should identify what are stress bearing areas and what are relief areas. On the stress bearing areas, you can take the advantage of these areas to not apply any spacer, and you can take maximum retention from these areas. And your border areas, they are mainly they mainly help you to gauge where should your denture end. This is the most difficult part. Why? Because when you make an impression for crown, you use putty and light body, right? But you have everything static, all the margins are static, so you can apply pressure and you can get a proper impression. But when you do that with a soft tissue which is moldable, like your limiting structures, so when you do that, what you do is over compress the areas. That's why when people ask me, do you instead of taking separate PI and FI, do you do putty and light body impression in one go? I say I don't do that. I mean that doesn't stick with me. I mean, where are your borders? Your border molding is the essence of denture. So your borders, your every movement, border movement should be recorded properly, so that you can give a successful denture. Otherwise, it's just like giving a crown. You cannot give a crown. You are giving a denture. There's a difference. A crown is something that is resting on a static surface. Your tissues are moldable. So I hope I'm clear with this point, that why I don't take only one impression of PI and FI together in one appointment with putty and light body, because we are not recording impression for crown. We are recording impression for denture. And again, this is about the mandible. Same things. I mean, I know you all have read about it, but this is just a little brush up about the relief areas and the limiting structures. Now, uh, why primary impression is so important, as I have emphasized, is you need a personalized primary impression for patient. There is no point in first taking a primary impression, modifying this, doing everything on one impression, placing green stick